Have you been trying to get pregnant and heard of Clomid? Well, in today's video, I'm going to be sharing with you everything you need to know about Clomid. It is one of the most popular treatments for women struggling with infertility. I'll be explaining how Clomid works, who should take it, and what to expect during the process of treatment. So whether you're just starting your fertility journey or seeking to find more information about this medication, this video is for you. Hello and welcome to my channel. My name is Sandra. I'm a registered nurse midwife with a BNSC degree. On this channel, we'll talk about all things health. If these are the type of content you are interested in, please do not make it your last by clicking on the subscribe button and the bell icon beside it so that when I upload a new video, you'll be the first to get notified. With that being said, let's dive straight into the video. Clomid is also known as clomiphene. It's a fertility medication used to treat women who are struggling to conceive. It works by stimulating the ovaries to produce more eggs. How this works is that it stimulates a rise in the luteinizing hormone, the LH, and the follicle stimulating hormones. These two hormones are responsible for the maturation and release of eggs from the ovary. When you take Clomid, the follicle stimulating hormone and the luteinizing hormone are stimulated, and then they trigger the ovary to release one or more matured eggs. And this release of an egg is what is known as your ovulation. So basically, Clomid helps to regulate hormonal balance, encouraging your body to release one or more eggs during ovulation, which can increase your chances of getting pregnant. Clomid usually comes in 50 milligrams, which is typically taken starting from the second day of your cycle for 5 days. Before you start taking Clomid, your doctor is going to run different hormonal tests, and ultrasound scans will be carried out as well. This will help your doctor guide you on the dosage to take based on your individual need and your health condition. Your doctor can even prescribe up to 150 milligrams, that is 3 pills per day, or 200 milligrams, which is 4 pills per day. This is going to be based on the result gotten from your test and your scan, and also based on your body system. Clomid is not a drug you self-medicate. Don't say because you have a friend who has taken it or you've heard people take it, you still want to take it. You just go ahead, buy it and start taking it on your own. Always remember that your body system is different from your friend's body and people you've heard take it. So it's always better for a doctor to prescribe Clomid for you, because it's going to guide you as you take it and follow up with you on the journey. You don't just buy it and take because you heard people take it. Please ensure it is prescribed to you by a doctor. And it's also very important for you to follow your doctor's instructions carefully to get the best result. Not every woman struggling with infertility will be prescribed Clomid. It is commonly given to those who don't ovulate regularly, like women suffering from PCOS, that's polycystic ovary syndrome. It can be prescribed for those who have irregular cycle or difficulty releasing egg. Clomid can also be prescribed for a woman who has done all the necessary fertility tests with her partner and everything seems to be okay. The results are perfect, but they are still finding it difficult to conceive after actively trying for like 12 months. So in this case, she would have been diagnosed with unexplained infertility. So this type of woman would benefit from Clomid as she's still ovulating. Clomid is just going to be used to stimulate her ovaries to release more eggs. And this is what is known as super ovulation, to increase our chances of getting pregnant. While Clomid can be an effective solution for many women, it comes with potential side effects. The most common ones are hot flashes, bloating and stomach discomfort, mood swing, pelvic pain, and breast tenderness. It also has some rare side effects such as blurry vision and double vision. And these symptoms usually go away once the medication is stopped. Some women may also experience multiple pregnancies, twins, or even more, because Clomid increases the chances of releasing more than one egg. Research found out that Clomid has about 70 to 80% success rate in stimulating ovulation. However, getting pregnant after ovulation depends on other factors including sperm quality, sexual intercourse timing, and overall health. It is important for you to see your doctor before starting Clomid. They will ensure the right treatment for you and also help you track your progress. And if you don't respond to Clomid after a few cycles, other treatments may be necessary. Also, Clomid is not suitable for everyone. If you have history of certain health conditions, you may have to try other options. Clomid has really helped many women achieve pregnancy, but like any treatment, it is not without its risk. So if you're considering Clomid, it is best you speak to your doctor to understand the best approach for you. And remember, fertility is a journey. Do not lose hope. If you've used Clomid before or know someone who has, kindly share your experience with us in the comments below. And don't forget to like, share, and subscribe for more fertility tips. And always remember, your health is your wealth. Little changes makes a big difference. Thank you for watching this video and see you in my next video. Bye.